Picture this. You're 400 miles from the nearest town. The scorching sun is cracking the earth around you. Your partner just took a bullet to the shoulder. The round went clean through. That's the good news. But the wound is open, red, and already starting to smell different. No doctor, no hospital, no antibiotics. What do you do? In the American Old West, that wasn't a philosophical question. It was today's problem. It was right now's problem. And the answer, more often than not, was literally growing at your feet. Today, you're going to discover the 20 plants that stood between life and death for settlers, cowboys, scouts, and Native Americans living on the most brutal frontier the modern world has ever produced. Everyone's seen the Western movies. The hero takes a bullet, falls, wakes up in a bed. He's fine. But the reality? The reality was much longer, much fouler smelling, and far more cruel. So the question is, how on earth did people survive? How did someone in 1867, deep in the Utah desert, with a rusted knife and zero medical training, treat a wound before the poisoned blood reached their heart? The answer lies in plants, in roots, in leaves, in knowledge that native peoples had carried for millennia, knowledge that white settlers barely had the humility to learn when they learned it at all. That's what we're exploring today. The wild pharmacy of the Old West. We're talking about the period between 1840 and 1900, the great westward expansion of the United States. Millions of people leaving eastern cities and throwing themselves into the unknown. The problem? The unknown was trying to kill you in every way imaginable. Rattlesnakes, scorpions, infection, fever, dysentery that drained the life out of you in days, battle wounds from the Lakota, Apache, or Comanche, horse accidents, wagon falls, bone-cracking cold in the Rocky Mountains, blistering heat in the Sonoran Desert. The average distance between a settler and the nearest doctor? Often more than 100 miles. On dirt trails, riding mules, that meant days, sometimes weeks. And if a doctor actually showed up, he probably had nothing useful to offer anyway. Medicine of the era was primitive in the extreme. Amputations with wooden saws, anesthesia made from cheap whiskey, instruments rarely sterilized. In many cases, the native healer or the midwife with her bundle of herbs was a better option than the white-coated doctor from the city. Let's get into what matters. 1. Echinacea. Echinacea purpurea. It was 1878. A group of settlers was crossing Kansas when the fever began to spread. First a child, then the father, then 2 other men. The Lakota had a name for that purple plant growing across the prairies. They chewed the root into a paste and pressed it onto wounds. They swallowed the juice to strengthen what they called the spirit of the blood. The settlers who learned from them started doing the same. Echinacea root tea 3 times a day. The fever broke faster. The inflamed wounds seemed to respond better. Today we know echinacea contains compounds that stimulate the immune system. But back then, it was faith, desperation, and careful observation. And it worked. 2. Sage, Salvia officinalis. A cowboy named Thomas Reed wrote in his diary in 1872, "My arm cut started rotting. Bill gave me chewed sage leaves. 3 days later, the smell was gone." Sage grew across the entire American Southwest. The Apache used it as an antiseptic. Leaves were crushed, mixed with a little water, and pressed directly onto infected wounds. The strong smell? That was a sign it was working. The plant contains compounds with real antibacterial properties. But there was a dark side to this story. Many cowboys used sage on wounds that were already beyond saving. The plant could clear a minor infection, but against advanced gangrene, against bacteria already running through the bloodstream, sage didn't save everyone. Only those who got there in time. 3. Aloe vera. Aloe vera. In the Arizona desert, the sun didn't just burn the earth. It burned people. Working outdoors with fair European skin suffered severe burns that would inflame, infect, and kill. The Spanish missions and Franciscan priests traveling through the American Southwest quickly learned from the native peoples. Aloe vera was the answer. The plant grew wild throughout Mexico and the southwestern United States. The inner gel from the leaves was applied directly to burned skin. Relief was almost immediate. The inflammation went down. The skin didn't close so quickly into thick scarring. Cowboys called it the medicine plant. Simple as that. Today we know aloe vera gel contains polysaccharides, glycoproteins, and antioxidants. Back then, the only test was apply it, wait, and see if the patient dies or improves. Many improved. 4. Peppermint. Mentha piperita. Diarrhea killed more people in the Old West than bullets. That's not exaggeration. That was reality. Contaminated water, spoiled food, non-existent sanitation. Dysentery and cholera swept through entire camps. A family crossing the Platte River could be drinking the same water where animal carcasses floated 5 miles upstream. The result was a slow, agonizing death by dehydration. Peppermint tea was one of the most common remedies. It calmed intestinal cramps, reduced vomiting, gave the body a momentary truce to try to recover. But there was a problem nobody understood at the time. While they drank the peppermint tea to ease the symptoms, they kept drinking the same contaminated water, causing the problem. The remedy treated the effects. The cause kept killing. 5. Chamomile, Matricaria chamomilla. Toothache with no dentist. Baby colic with no pediatrician. Battle anxiety with no therapist. The Old West had all of it. And chamomile was the answer for almost everything related to pain and nerves. Pioneer women carried dried bags of chamomile in their wagons as one of their most precious possessions. The tea was given to babies with colic, to adults with severe toothaches, to soldiers suffering from what we now call PTSD. There was a custom among wagon trains. Before sleeping, after a brutal day, chamomile tea was prepared for everyone. It wasn't a luxury. It was a psychological necessity. People lived in constant fear. Fear of attack, fear of disease, fear of not reaching their destination. The nightly chamomile ritual was a moment of humanity in the middle of chaos. 6. Yarrow, Achillea millefolium. If you could carry only one plant in your Old West survival kit, many friends would say, take yarrow. The plant grows across nearly all of North America, and Native American tribes knew it as an almost miraculous blood stopper. Crushed leaves pressed directly onto bleeding wounds helped blood clot much faster. This wasn't superstition. Yarrow contains alkaloids that genuinely stimulate coagulation. In 1876, after the Battle of Little Bighorn, where Custer and his men were massacred by the Lakota and Cheyenne, some of the soldiers who survived were those who learned to use yarrow from the very Indians who would go on to fight them. There's a brutal irony in that story, one that shouldn't be overlooked. 7. Blue cohosh, Calophyllum thalictroides. This was the midwife's plant. In the Old West, giving birth was one of the most dangerous events a woman could face. No adequita nesiche, no sterilized instruments, no emergency C-section if something went wrong. Native midwives and the most experienced pioneer women knew blue cohosh. It was used to stimulate contractions when labor was taking too long, to speed the delivery of the placenta, to control postpartum hemorrhage. Was it effective? In some cases, yes. Dangerous? Absolutely. The wrong dose caused contractions so violent they killed both mother and child. This was the reality of Old West plant medicine. These weren't miracles. They were bets. And the midwives who knew the right dosages were as valuable as gold. Achta st. Just word, Hypericum perforatum. The German settlers who established themselves in Texas in the mid-19th century brought with them the European knowledge of medicinal plants. And St. John's wort was at the center of that knowledge. It was used to treat what they call melancholy. Today we'd recognize it as depression. And depression was something the Old West manufactured in great quantity. Imagine leaving behind everything you'd ever known. Your family in Germany, Ireland, Italy, crossing an ocean, then crossing half a continent, losing children along the way to disease, arriving at a dry patch of land and trying to survive. The psychological isolation was devastating. St. John's wort tea didn't save everyone, but for many, it was the only thread of sanity they had. 9. Metasweet, Filipendula ulmaria. Before aspirin existed, and aspirin wasn't synthesized until 1897, people used Metasweet. The plant contains salicylic acid, the same active compound that was used to create aspirin. The Cherokee and the settlers who learned from them brewed tea from the flowers and leaves to treat headaches, fever, and muscle pain. For a cowboy who worked 12 hours in the saddle, muscle pain wasn't a minor issue. It was part of every day. Metasweet was the relief that made it possible to get up the next morning and do it all over again. 10. Elderberry, Sambucus nigra. It was called the common man's apothecary. Elderberry was a complete plant. The flowers were used for fever, the berries for strengthening the immune system, the inner bark as a laxative, the outer leaves as an insect repellent when burnt. There was a belief among settlers. A house with an elder tree planted nearby was a protected house. The plant represented health, safety, resilience. In the winter of 1852, a wagon train became trapped in the Sierra Nevada for 3 weeks. Elderflower tea was the only medicine available when the flu began to spread through the group. Several survived. Some didn't, but the tea was merciful in that deadly cold. 11. Lemon balm, Melissa officinalis. The fear of death was constant, and fear, we know today, kills in other ways. Insomnia, severe anxiety, palpitations. Settlers called it the nerves. Today we call it acute anxiety disorder. Lemon balm was the most widely used natural sedative. Strong tea before sleep. For those standing night watch, cold lemon balm tea kept the mind alert without the constant nervous trembling. There was practical wisdom in this. A sentry who was too anxious made mistakes. A calm sentry survived the night. 12. Ginger, Zingiber officinal. Wagon trains carried dried ginger as one of their most valuable supplies. Road nausea, dizziness from the altitude of the Rocky Mountains. Motion sickness on horseback. Ginger was the answer to all of it. But there was one use that few history books mention. Ginger was given to people in shock after severe injuries. It didn't treat the shock, but the sensation of warmth it produced in the stomach seemed to anchor people's consciousness for longer. How much longer? Enough, sometimes, for someone to do what needed to be done. 13. Lavender, Lavandula angustifolia. The smell of lavender in Old West cabin was a sign that someone cared about life. Lavender oil was one of the few items pioneer women guarded as carefully as jewelry. It was used as an antiseptic on minor wounds, as a calming agent for children with fever, as an insect repellent when burnt. But the most surprising use? It was applied to patients with serious infections before improvised procedures, not as anesthesia, as an act of dignity, before amputating a finger, before cleaning a wound with a hot iron. The scent of lavender was a moment of peace before the pain. 14. Usnea, Usnea spp. This is the plant most people have never heard of, but it saved countless lives. Usnea is a lichen, not exactly a plant, but that's how it was classified at the time. It grew on trees throughout North America, especially in the humid regions of the Pacific Northwest. Native American peoples of the Pacific tribes used Usnea directly on infected wounds. And there was a reason for that. Usnea contains usnic acid, which has proven antibacterial activity. The explorers Lewis and Clark mentioned in their journals the use of tree moss by the natives to treat wounds. That was Usnea. For wounds that smelled wrong, that were starting to darken at the edges, that nobody knew what to do with. Usnea was pressed directly onto the flesh, and sometimes, just sometimes, the darkening stopped. 15. Skullcap, Scutellaria lateriflora. Attacks were unpredictable, and surviving an attack wasn't the end of the problem. It was the beginning of another one. Men who returned from battles with native warriors or from outlaw ambushes came back carrying something that went beyond physical wounds. Trembling, nightmares, the inability to stop hearing the gunshots in their minds. Skullcap was a native North American plant used by the Cherokee and Ojibwe to treat exactly that, what they described as the mind that won't stop. The tea from this plant contained compounds that act on the central nervous system. It wasn't a cure, but it gave the warrior, the survivor, enough nights of sleep to keep going. 16. Golden seal, Hydrastis canadensis. If echinacea was the antibiotic of the prairies, golden seal was the antibiotic of the eastern forests. The Cherokee called this plant the golden seal for the intense yellow color of the root. They used it to treat eye infections, mouth inflammation, and wounds that wouldn't heal. The powdered root was mixed with water and applied directly. The antimicrobial effect of berberine, a compound the plant contains, is today scientifically proven. In the Old West, when an eye started weeping pus, when lips cracked into inflamed sores, when a child couldn't swallow because the throat was so swollen, golden seal was what they had. Often it was enough. Often it wasn't. 17. Hawthorn, Crataegus spp. The old men of the Old West had hearts that suffered in silence. Decades of hard labor, diets heavy in animal fat, constant stress. Heart attacks were common, called apoplexy or simply the heart stopping. Hawthorn leaf and flower tea was the heart medicine that native peoples had known for centuries. Today we know the plant improves blood circulation and has an antioxidant effect. Did it cure heart attacks? No. But for those who felt the chest tightening, what we recognize today as angina, the daily Hawthorn tea gave extra years of life. Not decades. Years. In the Old West, years were an invaluable gift. 18. Lobelia, Lobelia inflata. This is the plant that killed the most and saved the most in the Old West. Called Indian tobacco by some settlers, Lobelia was used by Native Americans to treat asthma attacks and suffocation. The active compound, lobeline, is a potent respiratory stimulant. For someone suffocating from a severe allergic reaction or a brutal asthma attack, Lobelia could open the airways and save a life. But the margin between therapeutic dose and fatal dose was frighteningly thin. Many improvised healers miscalculated that dosage, and the person who had been suffocating before taking the Lobelia died of a plant overdose instead. There was a teaching that experienced healers passed down. With Lobelia, less is life, more is death. These were words to live by, literally. 19. Eastern red cedar, Juniperus virginiana. The battlefields of the Old West had a particular smell. Blood, earth, gunpowder, and when luck was present, the resinous fragrance of red cedar. The bark and leaves of the cedar were burned in Native American healers' lodges as a fumigate, what today we'd recognize as a primitive form of infection control through inhalation. The volatile oils of the cedar have antifungal and antibacterial properties. For wounds that needed to be cleaned from the inside, when there was no other way to treat them, the smoking cedar lodge was the method. The patient was placed under blankets with cedar branches burning slowly. The heat and vapors from the plant were the steam medicine. Did it work? For minor respiratory infections, yes. For open wounds exposed to heat and smoke, effectiveness was limited. But the alternative was doing nothing, and doing nothing was a death sentence. 20. Tobacco, Nicotiana tabacum. Tobacco wasn't just a vice in the Old West. It was medicine. Wet tobacco leaves were pressed over insect bites and snake bites to draw out the venom. At least, that's what people believed. For wasp and bee stings, there was some effect. Nicotine has mild analgesic properties. For a rattlesnake bite, tobacco did absolutely nothing against the neurotoxic venom. But it gave the patient and the family the feeling of doing something. And in some cases, the patient's mental state was what determined whether they'd survive the first few hours. Tobacco was also used on rotten teeth. Chewed directly onto a cavity, it numbed the pain for hours. There was a brutal logic to Old West medicine. Treat the pain first. The underlying infection, maybe later. If there was a later, here's what the books don't say. Most of these plants worked for mild cases. Superficial cuts, moderate fevers, pain that wasn't going to kill you. But the Old West wasn't full of mild cases. It was full of bullet wounds, rattlesnake bites, compound fractures with bone protruding through the skin, complicated deliveries without proper instruments. For those cases, the plants helped at the margins. They bought time. They eased the pain. But most people with serious injuries died anyway. The mortality rate from inadequately treated gunshot wounds was close to 60%. 1 in 3 rattlesnake bites was fatal. Complicated deliveries took the mother, the child, or both in proportions we consider unacceptable today. And plants were all there was. Western movies show heroes who take a bullet to the shoulder and are back in the saddle next day. The reality was the cowboy lying on the ground, flies landing on the wound, while someone tried to remember what the Navajo healer had taught them about the plant with gray leaves that grew near the creek. The real hero of the Old West wasn't the fastest draw. It was the one who knew what to do with the right plant at the right moment at the right dosage. It was the midwife who carried her bag of herbs for 3,000 miles of trail and knew every plant by name and by use. It was the old Apache man who watched settlers arriving on his lands, dying of diseases he knew how to cure, and who sometimes, not always, but sometimes, approached and said, "Use this." Something needs to be said clearly. Most of the knowledge about medicinal plants that settlers used in the Old West wasn't theirs. It belonged to the peoples who had lived on that land for tens of thousands of years before they arrived. The Cherokee, the Apache, the Lakota, the Navajo, the Ojibwe. Each tribe carried extraordinarily sophisticated botanical knowledge, developed over generations of careful observation. The settlers came and, in many cases, destroyed those cultures, killed the healers, burned the villages, banned the practices, and in doing so, they lost part of the knowledge that could have saved more of their own lives. There's a bitter and heavy irony in that story, one that official history rarely tells with the honesty it deserves. In the end, the Old West teaches us something that our modern era, with its hospitals, antibiotics, and surgeons on call, sometimes makes us forget. Human beings are fragile. A simple cut, a rotten tooth, a minor infection. In 1870, any one of those things could kill you in less than a week. And what separated those who lived from those who died was off knowledge. Simple knowledge. Knowing which leaf to crush, which root to boil, which plant to never give in excess. The plants we explored today were not miracles. They were tools. Imperfect tools in the hands of desperate people, trying to survive in a world where death was a constant neighbor. And in many cases, those imperfect tools were enough. Not for everyone, never for everyone, but for enough people that the story continued, that the children grew up, that the towns rose from the dust, that the West was built, with all its glories and all its crimes, in the flesh and blood of people who survived with the land they had around them. And that, in itself, is a story that deserves to be told. If you made it this far, you're part of a select group of people who aren't afraid to look at the past without a filter. Not the romanticized past of the movies. The real past. The past of ordinary people who did extraordinary things to survive. Subscribe to the channel. Hit the notification bell, because every week we dive deep into real stories that history books get from the final version. Next week, we're going to talk about what happened when the plans weren't enough, when the only available doctor was a barber with a knife and a bottle of whiskey, and what those men dared to do. You won't want to miss it.